Hello everybody, I do not have a visual representation, my apologies for that, but I do want to talk to you a little bit about what I'm here to kind of chat to you about, which is disability and access in the pandemic and how that shifted from working towards my PhD into now academia. So, I guess a little bit of a background. As the COVID-19 pandemic began to accelerate, I was progressing towards the end stages of my dissertation, autistic characters, decoding embedded sentiment. This dissertation, through the convergence of disability studies and literary cognitive studies, explores depictions of autistic characters in literature, explicitly identified autistic characters in literature, with the use of close readings and scaled readings, which is a computational analytics method using sentiment analysis to decode sentiment embedded in text. I investigated these characters through close readings in which I looked at my positionality within the major fields of study and the embedded medical and social histories coded into neuroatypical and neurodiverse literary representations of autism. So building upon the perspectives of my positionality in these histories, I explored how the substrate of literature is coded for a neurotypical and ableist-focused reading. And in my continued exploration of the embedded sentiment, I built upon traditional close readings to expand that decoded reading and that scaled readings to produce visual representations of sentiment. So I was doing pretty good. I was making great progress. I was on a very unique timeline for my PhD, as some people at MSU know. And for those that don't, I was sponsored by the United States Air Force to get my PhD, which meant I had 36 months to finish it. Yeah. With the pandemic, I stretched that timeline to 40 months, but I did do it. I know, right? So, enter the pandemic, and all of a sudden, like, as we all know, like, the world tilted, and everything just kind of halted for a little bit. Because now, all of a sudden, I had to take extra time to care for my 2 autistic school-age sons who were suddenly left without support for their education. And in the process of that experience, my dissertation shifted slightly, right? It was the intersection of theory and practice, and the lived experience of how things changed. And so what I found ironic about that particular moment is that people were trying to make sense of the concept of social distancing, and in the process finding that it was so very different from socially constructed societal norms to which they were accustomed. So seemingly overnight, people were no longer allowed to be social in the ways that society had trained them to act. There was anxiety and frustration over learning how to operate and function in ways that were contradictory to their way of being. People were no longer allowed to touch and be in physical contact with friends and extended family outside of the core family unit, and sometimes even within that core family unit if there was someone infected. So society was asked to operate by rules that minimize their capability to function through direct sensory inputs. In other words, society was asked to operate through more artistically focused ways of being in order to survive and allow the medical system to not be overwhelmed by a virus that flourished in social interactions, social physical interactions. But by minimizing, if not removing, the face-to-face in-person social aspects of their lives, people had a better chance of survival. And that survival depended on those artistically focused ways of being, the same ways that are stereotyped and were often diminished as lacking validity prior to this life-altering event. So society had to refocus their views to embrace an autistic presence because it became a way of being that could save and preserve life. So that strengthened my work on autistic characters. It brought a new perspective, it brought a new light into understanding how these connections are being made, how connections are different than just physical connections, and how the pandemic that brought social physical distancing developed social virtual closeness. And so what I learned in that very quick process was how each of my own children operated, and that helped me understand, I think, the autistic characters even better. So my older son is one of the, and I guess like being a mom to autistic children, there's ups and downs with that. A lot of just anxiety and learning things that are new, things that are unknown. And it was one of those things where I've always wanted to be the best parent, but I also wanted to understand my neuroatypical child and interpret his communications to provide for his needs and desires. And I know that how he communicates has many strengths, and he has a beautifully unique personality, loving qualities that emerge from his neuroatypicality. And I strive to help him understand that, but I don't want to take away who he is, because that defines his fundamental being as a person. And so I find myself in awe of, in that moment of all of a sudden being thrust into the full caretaker role, having to take care of his education, his obviously physical needs and everything else, that he would engage more fully than I could even with the world around me. He had a way of being that could engage with that, engage with those inputs in different ways. And so from that, I learned more. And then when my second son, who was very different from my oldest child, he was much more vocal, likes being more actively engaged in the world around him, whereas my older son is more observant and introspective. And so through their differences, I could say that both boys are inherently different, and they are, but it's also overly simplistic to say that they are fundamentally different because at their core, they're both autistic. And that's, I think, the beautiful part of the autistic experience that I learned through that experience was just how different their experiences are, and realizing, as the saying goes, if you've met one autistic person, you've met one autistic person. And so, through that, how to understand their unique needs and how to kind of see the diverse representation, the divergent representation of their minds. So through that experience of being more actively engaged in all aspects of their lives and the change in sociality, slow down a little bit there, I was able to make connections in ways that, through that dissertation, and understand kind of how best to champion them in society that, and I think society was more willing to accommodate them through that experience. So I think what I found as I finished my dissertation in December of 2020 was the acceptance and understanding of different ways of being in the world. That the neurotypical and ableist-focused social way of being is only one way, and it has its strengths, but it also has its flaws. And that's not to say that everything about the socially and physically connected way of being is wrong, but it should be recognized as a majority, and through the pandemic, no longer privilege is the only way that we should be and act. So in looking at autistically focused ways of being, we can gain insight on how to navigate the world without direct physical contact, but still have very meaningful and important connections to each other. And if we understand these constructs, we can better recognize what is great about physical connections, what's great about virtual connections, and how best to blend those into our lives. Because I think there's a meaningful and important place for both of them. And I feel like the pandemic brought that to light, that while there might have been a way in which we operated in the world before, there's a way that we can think about our operation in the world now because we've been exposed to something different. So how does that all translate into where I'm at now, as I mentioned at the very beginning, from PhD to academia? So I now work at an institution where everybody, as in the student population, is able-bodied or about to be able-bodied. And if the body cannot be made able, then the body cannot belong. So the institution, even from the pandemic, is grappling with meaningful changes. As humans, we tend to not want to change. We tend to want change, but not want to make change. Privilege. The pandemic disrupted the status quo by requiring change. So now all of a sudden, we were in meaningful conversations, and then now we are looking at how to classify diverse minds. And I think the pandemic brought that to light, where there's individuals who struggled mightily and significantly with not having that physical connection, whereas other people thrived, right? Having that virtual closeness allowed a different type of connection in a way that had never been available prior. So at my institution, the thing that is, I think, most critical and the thing that I brought forward from my experience working with my children, writing on my dissertation about autistic characters, is how to think of diverse and divergent minds. And while currently that might be classified as not able-bodied, I think there's finally the realization that you can't think outside the box if everybody thinks in the same box, right? In order to make and sustain meaningful change, you need to have diverse and divergent minds who think outside of different boxes. So there are now neurodiversity initiatives and meaningful changes slowly shifting in the conception of what able-bodied is and how we classify minds within that construction of able bodies. And so my work is, as I've gone back to my institution, provided structure for changes at an institutional level. I run workshops such as creating accessible classrooms for current faculty and building accessibility for new faculty to bring the best practices from disability studies to make spaces that are more accessible for everybody. So these workshops are essential because currently there's not necessarily policies at my institution designed to accommodate for accessibility beyond some basic needs such as concussion and mental health protocols. But obviously there's always a need for accessibility, and we all benefit from greater accessibility. And I think what I have been able to take from back to that idea of the intersection of theory and practice is understanding how these things interconnect with each other and bringing that into ways that can make meaningful change in a place that is very different. It does not look like Michigan State University, I promise you. But at the same time, there are still students and a student population that need to kind of understand how to connect with the world around them, and also recognize that while maybe their student population is either able-bodied or about to be able-bodied, they also work with a significant number of individuals who don't fit in that particular category. And so, like, looking for ways in which, again, what might benefit one person because it's necessary will also enhance somebody else's experience because now they have access to something that was never available before. So that is my discussion there on my work and how my PhD was influenced through the pandemic and how I have taken that forward into the work that I have been doing for the last 4 years since I finished my PhD successfully.